Pathophysiology of Pseudobulbar affect, Pba, and Nudexta pharmacology. The pathophysiology of Pseudobulbar affect, or Pba, is believed to occur when neurologic diseases or injuries disrupt the normal function of the cerebropontocerebellar neurocircuitry to receive critical information and fine-tune an appropriate emotional expression, thereby potentially leading to involuntary crying and/or laughing. Pba may involve changes in neural circuits that utilize a number of neurotransmitter functions, including glutamate. However, the pathophysiology of Pba is not fully understood. Nudexta, a combination of dextromethorphan, or DM, and quinidine, is the first and only FDA-approved treatment for Pba. DM is thought to interact with multiple receptors. For example, DM is believed to modulate glutamate signaling through its actions both as an uncompetitive N-methyl deaspartate, or NMDA, receptor antagonist, and as a sigma-1 receptor agonist. Consequently, the actions of DM are thought to reduce perturbations in neural circuits that may lead to Pba, but the exact mechanism by which Nudexta exerts its therapeutic effects in patients with Pba is unknown. DM is rapidly metabolized by CYP2D6. Quinidine is a potent inhibitor of CYP2D6, and the low 20 mg daily dose of quinidine in Nudexta is approximately 1/30th of the lowest recommended antiarrhythmic dose. Inhibition of CYP2D6 is thought to prolong the elimination half-life of DM up to 13 hours, which increases the bioavailability of DM by over 20-fold. Nudexta, the first and only FDA-approved treatment proven to provide clinically meaningful efficacy to patients with Pba.
Indication and usage. Nudexta, dextromethorphan HBr and quinidine sulfate, is indicated for the treatment of pseudobulbar affect, Pba. Pba occurs secondary to a variety of otherwise unrelated neurologic conditions and is characterized by involuntary, sudden, and frequent episodes of laughing and/or crying. Pba episodes typically occur out of proportion or incongruent to the underlying emotional state. Pba is a specific condition, distinct from other types of emotional lability, and may occur in patients with neurologic disease or injury. Important safety information. Contraindications. Quinidine and related drugs. Nudexta contains quinidine and should not be used concomitantly with other drugs containing quinidine, quinine, or mefloquine. Hypersensitivity. Nudexta is contraindicated in patients with a history of Nudexta, quinine, mefloquine, or quinidine-induced thrombocytopenia, hepatitis, bone marrow depression, lupus-like syndrome, or known hypersensitivity to dextromethorphan, e.g., rash, hives. MAOIs. Nudexta is contraindicated in patients taking monoamine oxidase inhibitors, MAOIs, or in patients who have taken MAOIs within the preceding 14 days due to the risk of serious and possibly fatal drug interactions, including serotonin syndrome. Allow at least 14 days after stopping Nudexta before starting an MAOI. Cardiovascular. Nudexta is contraindicated in patients with a prolonged QT interval, congenital long QT syndrome, history suggestive of torsades de pointe, heart failure, patients receiving drugs that both prolong QT interval and are metabolized by CYP2D6, e.g., thioridazine and pimozide, patients with complete atrioventricular AV block without implanted pacemaker, or at high risk of complete AV block. Warnings and precautions. Thrombocytopenia and other hypersensitivity reactions. Quinidine can cause immune-mediated thrombocytopenia that can be severe or fatal. Nonspecific symptoms, such as lightheadedness, chills, fever, nausea, and vomiting, can precede or occur with thrombocytopenia. Nudexta should be discontinued immediately if thrombocytopenia occurs. Hepatotoxicity. Hepatitis, including granulomatous hepatitis, has been reported in patients receiving quinidine, generally during the first few weeks of therapy. Discontinue immediately if this occurs. Cardiac effects. Nudexta causes dose-dependent QTc prolongation. QT prolongation can cause torsades de pointe-type ventricular tachycardia, with the risk of increasing as the degree of prolongation increases. When initiating Nudexta in patients at risk for QT prolongation and torsades de pointe, electrocardiographic (ECG) evaluation of QT interval should be conducted at baseline and 3 to 4 hours after the first dose. Some risk factors include use with CYP3A4 inhibitors or drugs that prolong QT interval, electrolyte abnormalities, bradycardia, or left ventricular hypertrophy or dysfunction. If patients taking Nudexta experience symptoms that could indicate the occurrence of cardiac arrhythmias, e.g. syncope or palpitations, Nudexta should be discontinued and the patient further evaluated. Concomitant use of CYP2D6 substrates. Nudexta inhibits CYP2D6 and may interact with other drugs metabolized by CYP2D6. Adjust dose of CYP2D6 substrates as needed. Dizziness. Nudexta may cause dizziness. Take precautions to reduce the risk of falls. Serotonin syndrome. Use of Nudexta with selective serotonin reuptake inhibitors, SSRIs, or tricyclic antidepressants increases the risk of serotonin syndrome. Anticholinergic effects of quinidine. Monitor for worsening in myasthenia gravis. Adverse reactions. The most common adverse reactions, incidence of greater than or equal to 3% and twofold greater than placebo, in patients taking Nudexta are diarrhea, dizziness, cough, vomiting, asthenia, peripheral edema, urinary tract infection, influenza, increased gamma-glutamyl transferase, and flatulence. These are not all the risks from use of Nudexta. Please see accompanying full prescribing information.